Over 50,000 people die from colon cancer each year in the US alone. But what if early detection could change this number? Let's find out how. Join us as we delve into the critical indicators of colon cancer. We'll break down each sign, helping you understand why they're more than just minor health issues. Stick around to learn how recognizing these signs not only enhances your health awareness, but could also be a life-saving decision. Warning sign. Number 1. Changes in bowel habits. One of the earliest and most common signs of colon cancer is a noticeable change in bowel habits. This alteration can manifest in various forms, such as persistent diarrhea, constipation, or a change in the consistency of stool. These symptoms might seem trivial or easy to dismiss as dietary issues, but they can be indicative of something far more serious. When a tumor develops in the colon, it can affect bowel movements in several ways. For instance, if the tumor is located on the left side of the colon, it is more likely to cause constipation. This is due to the narrower diameter of the left colon, where solid waste is more compacted. As the tumor grows, it can obstruct the passage of stool, leading to constipation. On the other hand, diarrhea can occur when the tumor irritates the lining of the colon, causing an increase in fluid secretion and faster transit of stool. These changes in bowel habits are not just discomforting. They are a signal from your body that something is amiss. A study published in the Journal of the American Medical Association found that individuals with persistent changes in bowel habits had a significantly higher risk of being diagnosed with colon cancer. This is particularly true for changes that last longer than 4 weeks. Warning sign number 2. Blood in stool, hematochezia or melena. The detection of blood in one's stool, medically termed as hematochezia or melena, stands as a crucial warning sign of colon cancer that demands immediate attention. Hematochezia is identified by the presence of fresh, bright red blood that often mixes with the stool. This manifestation is commonly associated with tumors located in the lower segments of the colon, or the rectum. In contrast, melena is characterized by dark, tarry stools, a clear indication of partially digested blood. This symptom is more frequently observed when the tumor resides in the right side of the colon. The critical aspect of these symptoms is their ability to hint at the tumor's location within the colon. Tumors on the right side of the colon are more prone to cause melena. This is because the blood from these tumors has a longer journey through the intestinal tract, allowing more time for digestion and alteration in color. On the other hand, tumors situated closer to the rectum, typically on the left side, are more likely to result in hematochezia. The truly alarming factor in these symptoms is the potential for significant blood loss that can often remain unnoticed. A study published in the World Journal of Gastroenterology revealed that patients with right-sided colon cancer frequently experience considerable blood loss, leading to iron deficiency anemia. This blood loss is not always visible, as the blood can be well disguised within the stool. This covert nature of bleeding underscores the importance of not dismissing any changes in stool appearance and seeking medical evaluation promptly. Furthermore, the presence of blood in the stool, regardless of its form, is a symptom that should never be taken lightly. It is a direct indication that the tumor is at a stage where it is causing damage to the tissues and blood vessels in the colon, signifying a potentially advanced stage of cancer. Early detection and treatment are vital, as they significantly increase the chances of a successful outcome. Warning sign 3. Abdominal pain and distension. Abdominal pain and distension are significant symptoms that can indicate the presence of colon cancer. These symptoms are particularly concerning because they can occur with tumors at any site in the colon, making them universal red flags. The nature and severity of the pain can vary, but it is often a persistent discomfort that warrants medical attention. Abdominal pain in the context of colon cancer can arise from several mechanisms. One common cause is the partial obstruction of the colon by the tumor. As the tumor grows, it can block the passage of stool, leading to a buildup of intestinal contents and increased pressure within the colon. This pressure can manifest as a dull, aching pain throughout the abdomen. In more severe cases, if the tumor causes a complete obstruction, the pain can become intense and cramping, often accompanied by bloating and abdominal distension. Another cause of abdominal pain is the invasion of the tumor into surrounding tissues. As colon cancer progresses, it can extend beyond the lining of the colon and affect nearby organs and structures. This invasion can lead to a sharp, localized pain, which may worsen with movement or pressure. Additionally, if the tumor perforates the wall of the colon, it can lead to a serious condition called peritonitis, characterized by severe diffuse abdominal pain and rigidity of the abdominal muscles. Abdominal distension, or the feeling of fullness and swelling in the abdomen, is another symptom that should not be overlooked. This can occur as a result of the tumor blocking the passage of gas and stool, leading to a buildup in the intestines. The distension is often progressive and can be accompanied by a noticeable increase in abdominal girth. In some cases, the distension is so severe that it can cause difficulty in breathing due to pressure on the diaphragm. The significance of these symptoms is underscored by various studies. For instance, research published in the International Journal of Colorectal Disease found that abdominal pain and distension were among the most common presenting symptoms in patients diagnosed with colon cancer. These symptoms were particularly prevalent in cases where the cancer had advanced to a later stage, emphasizing the importance of early detection and intervention. Warning sign 4. Unexplained iron deficiency, anemia. Unexplained iron deficiency anemia is a critical warning sign of colon cancer, particularly concerning when no other obvious causes are present. This type of anemia often results from unrecognized chronic blood loss in the stool, which is more common with right-sided colorectal cancers. The insidious nature of this blood loss means it can go undetected for a long time, leading to significant iron deficiency. Iron deficiency anemia, in the context of colon cancer, occurs when the tumor causes bleeding within the gastrointestinal tract. This bleeding is often not visible to the naked eye, especially when the tumor is located in the right side of the colon. The right colon, with its larger diameter and more liquid content, allows blood to mix and dilute with the stool, often going unnoticed. Over time, this continuous subtle blood loss leads to a decrease in the body's iron stores, resulting in anemia. The symptoms of iron deficiency anemia include fatigue, weakness, pale skin, shortness of breath, dizziness, and sometimes chest pain. These symptoms are often attributed to other, less serious causes, which can delay the diagnosis of colon cancer. A study published in the American Journal of Gastroenterology highlighted the importance of investigating iron deficiency anemia, as it can be the first and sometimes the only sign of underlying gastrointestinal malignancy, including colon cancer. Warning sign 5. Weight loss and fatigue. Weight loss and fatigue, though common and often vague symptoms, can be crucial indicators of colon cancer. These symptoms are frequently overlooked or misattributed to less serious health issues or lifestyle factors. However, their presence, especially when unexplained, warrants a closer examination for potential underlying causes like colon cancer. Unexplained weight loss, in the context of colon cancer, is a particularly concerning symptom. It can occur through various mechanisms, one of which is the alteration of the body's metabolism. Colon cancer can lead to an increased metabolic rate, causing the body to break down proteins and fats more rapidly than usual. This heightened catabolic state results in weight loss, even without significant changes in diet or exercise routines. Another mechanism contributing to weight loss is the physical presence of a large tumor in the colon. Such a tumor can create a sensation of fullness or pressure in the abdomen, leading to a reduced appetite. Patients may report feeling satiated after consuming only a small amount of food, significantly reducing their overall caloric intake. This decrease in food consumption over time contributes to weight loss. Persistent fatigue in patients with colon cancer is often linked to iron deficiency anemia, a condition where the body lacks enough healthy red blood cells to carry adequate oxygen to its tissues. This deficiency, as previously discussed, can be a result of chronic, unnoticed blood loss through the stool. The lack of sufficient oxygen in the body's tissues leads to fatigue, weakness, and sometimes even breathlessness. However, fatigue in colon cancer patients can also stem directly from the cancer itself. The body's immune response to cancer can lead to a state of chronic inflammation, which, combined with the energy demands of a growing tumor, can result in an overall feeling of tiredness and lack of energy. This systemic response to cancer is often compounded by the psychological impact of the disease. The stress, anxiety, and depression that can accompany a cancer diagnosis contribute significantly to feelings of fatigue. To recap, we've covered the 5 warning signs of colon cancer: changes in bowel habits, blood in stool, abdominal pain and distension, iron deficiency anemia, and unexplained weight loss and fatigue. Recognizing these signs early can be key to early diagnosis and treatment. Remember, your health is in your hands. Stay informed, stay vigilant, and take care.